There's one thing that all of us will need at some point in our lives: healthcare, making these professionals critical to our well-being and survival. But in order to have a high-quality, expertly trained workforce, they must be educated. For those interested in these fields, higher education for health professionals is a lot more accessible than some might think.
I think the criticism with the ROI for a college or university is that many fields don't lead to a successful career. And fortunately, that's not the case in the health professions. Whichever health profession you're looking at, whether it's physical therapy, speech-language pathology, physician assistant, psychiatric rehab, nutrition, cytopathology, clinical lab, they all require a degree from a college or university in order to be licensed in order to practice. And all of these fields are growing really fast, much faster than average. A degree from a college or university is the only path to practice in a health profession. In that model, we can ensure that people are trained competently to practice effectively and safely to maximize patient outcomes.
Our goal here at Rutgers Health is to really teach our students how to work as members of highly functioning interprofessional teams, to learn with, from, and about each other. And so we don't want it to just be, oh, I'm going to give you a lecture and tell you what nurses do. Instead, we want the students to be involved in case-based learning so that through that process, they can see what the variety of roles are that each of the health professions will play.
Established with a culture of collaboration, the Rutgers School of Health Professions instills a strong culture of collaboration as interprofessionals work together to create real change in the healthcare system.
So for example, we have a CVA case, a case of a woman who has a stroke. And for that case, we probably have close to 570 plus students. We have students from the School of Health Professions, from the PA program, the physical therapy program, from occupational therapy, speech therapy, and we also have students from clinical nutrition who participate in that case. And one of our goals in that case is to really have the students understand that a subset of the health professionals saved this woman's life. A PA may be in the emergency department, nurses are in the emergency department, physicians are in the emergency department. But as this case progresses, what we really want them to understand, it's the other professions who give this woman her life back.
There's no getting around it. Education is essential to ensure a healthier future for all, and it's not out of reach. There is something for anyone who has a passion for making the world a healthier place.
There are several reasons why someone should consider Rutgers University to study in the health professions. One, we are in one of the most diverse and tech-forward areas of the country. And with that culture of excellence and innovation that Rutgers has, it makes a wonderful place to learn. Two, all of our students are trained in interdisciplinary environments, and by working very closely with our health partners, we can ensure that our students are competently, both culturally and clinically, as well as through interprofessional education, to be the top of their fields when they graduate.
Donna Gallagher specializes in treating individuals with eating disorders and is working towards her doctorate degree from the Rutgers School of Health Professions. She explains how the program is equipping her with the knowledge needed to make a profound impact on this patient population.
I have always loved nutrition and food and went to Rutgers for my undergraduate degree. I got a Bachelor's of Science in Nutrition and Dietetics. I opened up my own private practice and then co-founded an outpatient treatment center for eating disorders with a colleague of mine. It was really full circle for me because I started at Rutgers, wanted to finish at Rutgers, and because the program is outstanding. Eating disorders are really complex, so I thought I wanted to get back to basics in terms of the nutrition science, and I also wanted to read research, practice-based research, that now I can hopefully create a better treatment environment and assessment environment for my patients and possibly for the eating disorder world at large.
I think one of the greatest things about this program has honestly been the faculty. They've been supportive in a variety of realms. If it's trouble with academics, they provide support and they provide me resources in order to get better and get back to focusing on academics and improving. I have no problem essentially talking to any of the faculty and reaching out to any of them for help because I know they got my back.
Our vision is improved health and healthcare for all. And what that encompasses is rigorous education, research and scholarship, and service to our communities. If you are considering a career in the health professions, I would take a serious look at Rutgers School of Health Professions.